Hi, I'm Dr. Jomaa. Welcome back to my channel, The Sports Med Specialist, and our current Jiu-Jitsu Injury Series. This is the second episode in the Jiu-Jitsu Injury Series, and today we're going to be exploring concussion. So in today's episode, I'm keen to give a general overview about concussion and how it links to combat sports and Jiu-Jitsu. After that, we'll go into addressing the question of what is a concussion? So how do we define it? How do we recognize it? And how does a doctor go about diagnosing it? After that, we'll look at why is concussion so important. Finally, we'll talk about what a doctor would recommend that you do about concussion. Before we get into all of that, this is all educational and informational content. It's not medical advice, and if you've had a concussion or know someone that has, they should definitely go and see their own doctor. Let's start talking about what the definition of a concussion is. A concussion is defined as a transient neurological disturbance which is caused by an impact to the body or the head and ultimately leads to a force impulse reaching the brain. The best way to think about this is to consider an acceleration or deceleration force affecting the brain within the skull vault. A good analogy might be in a boxing match where a number of jabs would maybe distress the opponent, that cause injury to the nose, maybe fractures to the face or lacerations around the cheek, but they're not likely to cause concussion. On the other hand, an uppercut which catches the jaw and forces the head to flick backwards or spins the jaw is far more likely to cause the opponent to get knocked out, lose consciousness, and develop a concussive episode. One thing that's really important to stress is that just because someone hasn't been knocked out, it doesn't mean that they haven't had a concussion. In fact, loss of consciousness is present in less than 10% of concussion episodes. Symptoms might evolve over the course of minutes to even days after the blow to the head. Most commonly, patients will present with quite classical symptoms of headache, dizziness, blurred vision. Very often there's a transient disturbance in their ability to be consciously present in any given scenario. To the doctor or to whoever's examining them, that appears as a sort of a blank, vacant stare, which is really classical and really characteristic of a concussion. What they describe this as feeling in a fog, not feeling quite right, feeling like they're slowed down. Moving away from patient-reported symptoms, there are also a number of different signs that we can look out for when watching sport which can highlight a likely concussion. These include staggering or stumbling, loss of consciousness, an unprotected fall to the ground, any evidence of seizure activity, lying motionless on the ground for a prolonged period of time, generally anything over 10 seconds. In addition to this, any evidence of a severe neck injury or fracture to the skull should also lead to an athlete being withdrawn from their sport. Okay, so now that we've talked about what concussion is and how it presents, let's talk very briefly about why it's so important. Well, the key issue is with regard to complications, and these can be broken down into short-term complications and long-term complications. In the short term, the major fear is of something called second hit syndrome. Essentially, what we've seen here is a syndrome where an athlete who's had a concussion and then goes on to have another secondary major blow to the brain, having very quick onset swelling inside of the brain, and this can lead to death. Thankfully, this is extremely rare, but of course it's catastrophic when it occurs, when all that really needed to happen was that the concussed athlete was brought off the field and protected for their own sake. Concussion also, when it's missed and athletes play on, is very likely to lead to very poor performance, disorientation of the player, and increased risk of them having further injury. The major long-term complication is CTE, or chronic traumatic encephalopathy. CTE presents in athletes as a whole host of psychosocial presentations as well as clinical ones. So whilst they might have headaches, dizziness, blurred vision, they're also seen to be at higher risk of substance abuse and general mental health conditions like anxiety and depression. Of course, on top of this, there is a strong correlation to progressive neurodegenerative conditions like Parkinson's disease, which was seen in the famous boxer Muhammad Ali. Let's briefly talk about management of concussions, and there are essentially two ways to look at this. For most sport, so we're talking about sport in the community setting, there's a very clear recognise and remove policy. Another way this is put is, if in doubt, sit them out. What this is getting to is the fact that There's never really a good reason to allow someone who's had a suspected concussion to continue playing their sport due to the risks involved. It's always better that they're withdrawn from sport and they sit out. In the professional sports setting, the diagnosis of concussion carries a lot more weight because we're essentially threatening the livelihood of this athlete and threatening the major investment in the athlete that the club have made. And so a misdiagnosis of concussion is extremely costly. So that clinical decision is made using as much information as possible, and doctors will usually follow something called a SCAT 6, or the Sports Concussion Assessment Tool, and it's the 6th iteration of it. The SCAT 6 is a handy document which can be found online. It helps guide doctors in terms of answering the questions of what are the observable signs, quantifying the symptoms, and then seeing how that sort of changes week on week. And it also contains a lot of prompts for neurological assessments as well, such as examination of the cranial nerves, vestibular function, balance, etc. So what do we do after the athlete's been withdrawn from sport? Well, for the most part, athletes don't need any further intervention so long as they've been checked over by a healthcare professional. But there are certain signs that definitely need to be looked out for. Any evidence of recurrent vomiting, so vomiting 3 times in a row, is a red flag. In addition to this, any progressive reduction in any neurological function, so for example, weakness in the arms and legs, drowsiness, slurred speech, all of that is also considered a red flag. And whilst a mild headache is fairly normal, a severe, unrelenting headache, and particularly one that gets worse when the athlete stoops forward or leans forward, is another big red flag. And any red flags necessitate an immediate review in the emergency department. So how do we manage a concussion once it's been diagnosed? The mainstay of management is that we try to protect the athlete and get them back into sport when they're safe. The best way to do this isn't just to withdraw them from all sport entirely for an extended period of time, but rather to withdraw them initially and then gradually reintroduce them to sport and sporting activities as their symptoms tolerate. This is called a graduated return to play program. What they recommend is a gradual return to play with a minimum 14-day stand down from all contact sport and a minimum 21-day stand down from a return to competitive contact sport. Similar policies are seen in the elite level in different sports, but sadly they remain quite varied. And so the policy for Aussie rules football is very different, for example, to the policy of rugby league, etc. So that's been a whistle-stop tour of a very important topic in sports and exercise medicine. If you're an athlete in Jiu-Jitsu or a healthcare provider who works with combat sport, hopefully that's helped give you an understanding as to how a sports and exercise physician approaches concussion. If you've got any comments about today's video, please leave them in the box below. Thank you so much for watching this video, and I'll see you in the next one.